Hi, everyone. We're going to get started. I'm so excited that you're all here. Today, we're going to be diving into something that is seriously next level when it comes to energy, brain function, aging gracefully, and just all around feeling better from the inside out and unlocking the fountain of youth with NAD and Niagen. And this is going to focus on the science of the cellular energy and longevity. So, you're going to see as we go on, it's going to be a lot of sciencey terms. If anyone has any questions, feel free to ask in the chat and I will answer them either on as we go on in the webinar, or I have some time set aside at the end to answer any questions you may have. So feel free to shoot them in the chat for me. So NAD, it's all about your cells and two incredible therapies that we're going to be talking about, NAD and Niagen. If you've ever wished that you wanted or needed more energy, clearer thinking, better recovery, especially after workouts, or even stronger support for your immune or nervous system, this webinar is for you. So now this is our agenda that we're going to be focusing on. What is NAD? What is the science behind it? What are the benefits of NAD and Niagen therapy here at Bluebell? Who needs it? Niagen versus NAD. So first, I just wanted to introduce myself and tell you all about my experience. So my name is Aubrey Cesarone. I am a nurse. As far as my background, I graduated with my RN in 2017 and my BSN in 2018, both from Gwinnett Mercy University. Before I was here at PrimeIV and Bluebell, I specialized in advanced heart failure and mechanical circulatory support in critical care in Center City, Philly since 2018. Specifically, I was at Jefferson Hospital. Now I am fully transitioned and I'm super committed to wellness here at PrimeIV in Bluebell. And I'm super excited to be here and super honored. So now let's get into it, the VIP of the show. So what is NAD and why does it matter? So NAD is like the spark plug to your cells. Without it, your cells, they can't make energy. Literally, NAD is essential for turning the food you eat into usable energy. It also repairs DNA, it fights off cell stress, supports brain, heart, and immune health as well. So here's the kicker about NAD. The levels drop in our body as we age. Not only as we age, actually, but it does it faster as we go through life, what life throws at us. So, stress, poor sleep, chronic illness, substance abuse, whether it be alcohol or drugs, as we go through those times in our life, it depletes the levels even more. So lower energy, NAD in our body equals lower energy, brain fog, slower recovery. So it's more so as we age, you're just not feeling like yourself and how you were years ago. So you need to get that energy back, right? So before we dive into NAD and NR infusions, how they can change the way that you feel, we have to talk about what's going on inside your body. Because once you understand the science behind it, the rest is going to make perfect sense. Don't worry, I'm not going to throw biochemistry textbooks at anyone, and I'm not going to make it super confusing. I'm going to try to make it simple, try to make it a little fun, and I apologize in advance if it's a little corny because it might get a little corny. So your body. Think of your body as a big power grid at a power plant. Every one of your trillions and trillions of cells in your body, it's like a little powerhouse that needs energy and fuel in order to keep you moving, thinking, healing, just existing as a human. At the center of that power plant is, drumroll, the mitochondria. Mitochondria, and we all know that, right? It's bringing us back to eighth grade. Because something that I totally remember from my grade school days is the mitochondria, because everyone knows because of that, it was drilled into our brains that the mitochondria is the powerhouse of the cell. And it really is true. Your mitochondria's job is to make ATP, something else you probably remember from science class in the seventh or eighth grade. But ATP can't make energy without, and here we go, NAD. So NAD stands for nicotinamide adenine dinucleotide. No, you don't need to remember that. Took me a while for it to roll off of my tongue or even for my brain to remember it. So just remember it as NAD. It's the molecule that flips that on switch for energy production. It helps your cells turn the food you eat into ATP through something called the Krebs cycle. Think of NAD as the VIP guest who is required for the party, and think of that party as energy. And that party can't start without that VIP guest. So energy can't start or happen without NAD. Without NAD, your mitochondria, they start falling asleep. And what does this mean for the body? It means low energy, slow thinking, poor recovery. You age faster, and your body, you have a body that's just tired and tired all the time. Now, Niagen is the trade name or brand name of what is nicotinamide riboside. Kind of similar, nicotinamide adenine dinucleotide, nicotinamide riboside. Again, you don't have to remember nicotinamide riboside, just remember NR or Niagen. So it is the precursor to NAD. And what that means is that NR, the body can take NR or nicotinamide riboside and convert it into NAD inside of your cells. It's like when you get a Target and you get a new side table, and that side table, you have to build it, right? So, that box that you buy that side table in comes with instructions, and it comes with all the material that you need to build that side table. So, NR are the materials and the instructions to build this side table. And think of that as what NR is for the body. So, it has the instructions and it has the materials in order to build NAD inside of your cells. So, let's break down both of them. NADIV, it gives your body the fully formed NAD, extracellular. It circulates extracellularly and it breaks down. And it gets broken down and then absorbed into your cells. And NR, it sends the blueprint and materials into your cells intracellularly, and your cells build up into NAD inside the cell. So it gets right into the cell and builds it up. And both roads that these two molecules take, they lead to more NAD inside your cells, but they take different paths, and it's where things get a little interesting. So we might get a little sciencey here with the extracellular and intracellular. So bear with me. NAD, think extracellular, outside the cell. So when we infuse NAD directly into your bloodstream, it hangs outside of your cells first. So it's a really big molecule. Think of it as the same size as your cells. So your body has to break it down a little bit before pulling it into the cell. So that's why it's extracellular. It breaks down and gets pulled in. And that breaking down of the molecule is what sometimes causes those temporary and sometimes uncomfortable side effects that happen with NAD infusions. Some of these include, and we'll get more into it later, chest pressure, nausea, things like that. Now, Niagen, or NR, nicotinamide riboside, the precursor, think it is intracellular, so think it as small and kind of sneaky. It is think of it as like the already broken down version of NAD, so it gets sucked right on into the cell and it builds back up. So it slips in there, quickly gets turned into NAD right where it's needed. No breakdown drama, no uncomfortable side effects, little to none, and just smooth absorption and faster. So this is where I like to compare the two. Think of it as trying to get into your house, trying to get into the front door. So NAD, it has to find the key to get inside the house. You don't remember where you hid the key. Which rock is it under? So NAD is just breaking down. It's looking for that key. Where did I put it? Oh, there it is. It's broken down. Then it gets into the house. It takes a little while. Whereas NR, it already has the key. It's right on the keychain, and it unlocks the door and gets right on in. So it's nice and easy for Niagen to get in. So what happens once NAD or NR or Niagen gets into the cells? NAD, it fuels the Krebs cycle, where your mitochondria then turn it into ATP or energy. You feel more alert, energized, focused, no brain fog. Your cells start repairing themselves better. And then you age, this is the good part about it, right? You age slower because NAD helps protect your DNA and it reduces inflammation. And then this is what leads us into who needs NAD or Niagen. When I talk about NAD and Niagen to people, and I think about who needs it, I pretty much in my brain, I think everyone needs it. Everyone needs energy. Everyone needs NAD. Everyone needs to be productive, right? So really, this kind of pertains to everyone. So those individuals that are go-getters or constantly on the move, on the go, if you're hitting a midlife slump and wondering where your energy went, you need NAD. If you've got brain fog, or you go into a room and you're like, why did I walk into this room for in the first place? Like you can't remember what went into the room for, you went into the fridge for, you can't remember. You need NAD. Um, if you're into fitness or you need muscle recovery, you need NAD. If you want to biohack your way into anti-aging or looking younger, you need NAD. If you're recovering from substance abuse, whether it be alcohol or drugs, you need NAD because when you are depleting your NAD levels even faster when you use these substances, or if you're just plain feeling tired, you need NAD or Niagen. NAD IV, it delivers NAD directly into your bloodstream. It goes where it needs to go. There are other options that you can have, such as injections, which we do offer here at Prime IV and Bluebell. There are pill versions, but think now this is where I'm getting into the IV therapy and why it's better than, taking pills, is it has to go through the gastric system, right? So your body's not actually absorbing all of the NAD that's in that pill that you take. You're actually only absorbing about 20 to 25% of that when you take it orally. Whereas when you're going IV, it is going exactly where it needs to go and you're getting 100% absorption. Think of NAD as like plugging your NAD IV therapy as plugging your body into a charger. So you're going from 5% to 100%. Um, Now, what does it feel like? Some people say that when they're going through their NAD journey or getting NAD or Niagen therapy, they feel a wave of mental clarity or physical energy. Some during the infusion, most after the infusion, and some people are like they feel it immediately after the infusion, they feel a couple hours after, and maybe the next day, a couple of days. Everyone's a little different, but suddenly, a lot of people tell me that they feel like they're firing on all cylinders. So let's compare them. NAD, what is it? It's the active NAD molecule. Remember, it's that big molecule, but it has to break down, right? Whereas Niagen is the NAD precursor. It already has the key to the house to get right into the cell intracellularly. The speed of action. Slower increase with NAD, whereas Niagen almost immediate within a few hours. Side effects. NAD, because it has to break down in order to get into the cell, that breaking down process causes chest tightness, nausea, sweating, and flushing. Not on everyone, but most people do experience these symptoms. And that leads us into the time commitment. When you get an NAD infusion, it may take anywhere from 2 to 6 hours. And the reason why it's such like a large amount of time in between the two is because we are going to titrate that infusion, which means we're going to make it slower or faster depending on how you feel. So if you're feeling chest tightness, we're going to slow down that infusion so it's less on your body, because we don't want you to feel terrible during your infusion. Now, when you get an NAD infusion, you will have an entire room to yourself with a TV. We have some clients that work from the NAD room, others that are like, let me just log into your Netflix and watch a show or continue watching my show. Others just, take a nap and just relax. It all depends on the symptoms that they're feeling, but you get an entire room to yourself with a recliner. We are able to pre-medicate you, or give you Zofran if you are feeling nauseous during it. But that is NAD. Whereas Niagen, the side effects of that is little to none. The side effects that we've seen mostly is some jaw discomfort, maybe some tingling in the jaw, or congestion, nasal congestion, where you have to blow your nose. And nothing that, you can't just have a box of tissues next to you, just blow your nose. And that usually goes away almost immediately after the infusion. You typically just feel those symptoms during the infusion. Same thing with NAD, those symptoms go away typically when the infusion is over. But with Niagen, we can actually have you in one of our very comfortable, state-of-the-art, I like to call them little space eggs, one of our awesome massage chairs, because you're not experiencing that nausea or chest tightness. You can, and it's a pretty quick infusion, 30 to 60 minutes. You can sit in one of our massage chairs while you're getting your Niagen infusion, which is really, really awesome. So which one should I choose? Should you choose? Um, Go for NAD IV if you are in recovery or feeling depleted. You can handle a longer IV session, or if you're on a budget, because cost is another thing. NAD therapy, it can be kind of expensive, but NAD therapy has a set cost, whereas Niagen, because it's little to no side effects and faster, it is pretty much about double the cost of NAD therapy. So really, it's whatever fits your budget, I would say is better for you. And NR or nicotinamide riboside Niagen IV, if you want a gentler introduction to NAD therapy, if you're focused on brain function, autoimmune support, or inflammation, Niagen's great for you. If you want shorter IV sessions and zero side effects. If you want to be in and out, Niagen's for you. In fact, even with Niagen, so NAD, you can only get it by itself. Niagen, we can actually give it with all of our micronutrients except for B100 because we don't want to mix it with extra B3. But you can, get a Myers cocktail and have your Niagen in that IV drip that you're getting with us. So that is something that sets apart the two as well. Um, some questions that we've gotten include, can I maintain my NAD levels with both? Yes, we have some people that, they'll do their first four infusions to up their NAD levels with just the NAD therapy because it can be expensive. And then they say, let me do my maintenance doses, to keep your levels up high so that they don't deplete because they're going to continue to deplete. You want to keep them up high. I want to maintain it with Niagen because I just want to be in and out, in and out, in and out. That is fine. Do it monthly, bi-monthly, quarterly, whatever you see is fit for you, or whatever you feel that you need. That is what you should be doing for yourself. Same thing with Niagen. I mean, some people will start with Niagen and then they'll do their maintenance doses with NAD. Whatever works for you, if you want to go back and forth, we are here to help you. And we can tailor something specifically for you. And that's why I put a picture here of Cher. Turn back time like Cher with NAD. Um, and now we're getting into what does NAD therapy look like at Prime IV in Bluebell? Um, so what we recommend for clients is that because your NAD levels are down here and we want them to come up here, we recommend you doing four infusions. We call it a series within 28 days, as close together as possible. It is ideal if you can get it 4 days in a row. Niagen, it may be a little bit more feasible because you're not sitting in a chair for 2 to 6 hours. So if you do four Niagen infusions, say, you come in at 10 a.m. every single day for 4 days or 5 o'clock every single day for 4 days, you can do that. But as long as you have those four infusions within 28 days, you're going to send your NAD levels up. But once you're up here, you don't want to come back down here. You want to keep them maintained so we can maintain that with however, your budget or however you feel fit. So whether if you want to keep it maintenance with NAD or Niagen, whatever works for you. Like I said, we can work that out when you come in for a consultation here at PrimeIV and Bluebell. Um, if you want to learn which one is best for you, I invite you to come in for a consultation with one of our nurses. We can talk you through the entire process and make sure that your first session and your following sessions are smooth, safe, and powerful. Your cells are ready. They need it. They're hungry for it. Are you ready? If you are interested in even coming in for a consultation, I'm offering the webinar, a free NAD consultation with one of our nurses and clearance from our nurse practitioners. I'm also offering, if you mention it in your consult, 5% off your series of NAD or Niagen. So it's text me or text us at 267-627-3023. If you want to schedule a consultation with us, I can get you set up with that. Or if you have any questions, let me see if I have any in the chat. I don't think I do just yet. No, but if you have any questions, please put them in the chat. I am going to leave about a minute or two to answer any if anyone has questions. Thank you so much for coming to this webinar. We did record it and we are going to post it to our YouTube. This is the first of our series, our transformation series here at PrimeIV and Bluebell. We're going to have our another webinar in a few months. We're not sure on what the topic is going to be. If you have any suggestions for a topic, you can email us, or if you want to text us, say, hey, I would love to learn more about this. I think it'd be great for a webinar. Let us know. We'll do something like this again. Like I said, in a couple of months, and look out on our social media or even in the spa. We have it at our concierge area. What our next webinar is and when it will be. But like I said, this will be recorded and on YouTube. Let's see, any questions in the in the chat? Let's see. I don't see any, but again, thank you all for coming. Like I said, take advantage of that free consultation that we're offering. You can text us again at that number. I'll bring it up again. Um, 267-627-3023. We want to bring you on into Bluebell, see what we're all about. And it doesn't even have to be NAD and Niagen that we talk about. We can talk about our IV therapy, our peptide therapy, different things like that. We will tailor a wellness plan for you because we are here with you on this wellness journey to be a better version of yourself and turn back time and be more like Cher, right? All right, no questions in the chat. Thank you all, and I will see you at our next webinar. Oh, I have one question here. What are the benefits NAD can provide for mental health, depression, anxiety, and mood? So when you have better energy and you load up your cells with all of this, it is going to flick your mood. So a lot of people describe it as after they get NAD therapy, they look at things in a different perspective. And, they say, instead of immediately going to the negative and immediately going to the worst case scenario, that it gives them a whole new perspective on what the issue is or what they're going on in what's going on in their life. It really gives you a new perspective on things, and you look at it in a different light. So it definitely makes you more of a positive person. I think we have another question coming. Dad, what's your question?
Post surgeries, good, better?
Yes, it actually is very good in helping in recovery for surgery because when you get surgery, it actually depletes your NAD levels. So to repair the body and reduce inflammation, NAD can help with that as well.
How about chemotherapy?
So actually, that's a really good question. Something I actually didn't even mention in the webinar. A contraindication for NAD therapy is cancer history. So if you have a history of cancer or you're actively going through cancer treatment, NAD is not for you. Not because it's bad for it, but because there isn't really that much information on it. Not many studies that show if NAD can differentiate which cells to replicate or which cells to repair. So, I mean, if you have so cancer is bad cells, right? So if you have those bad or damaged cells, we don't want to replicate those bad cells. We do not want to bring them to light. Again, that may change in the coming years with studies as they go on, but it is a contraindication. So if you have a history of cancer or are actively suffering from cancer, NAD is not for you for now. All right. Any other questions? You can raise your hand and ask them if you'd like. Okay, great. Like I said, you can always text us. If you had any more questions, you can always email me, come in for your consultation, and I can answer any other questions you may have. Thank you all for coming and have a great rest of your day.